So I was diagnosed with Meniere's disease back in 2019, and the reasons why they believed I have Meniere's disease is because I have debilitating vertigo, and from that, nausea and vomiting that greatly affects my life.
Okay. Any fullness in the ears?
Yes.
Because that goes along with that same diagnosis.
Mm-hmm.
Tinnitus or ringing in the ears?
Mm-hmm.
Okay. Any hearing loss?
Not that has been recorded.
Okay. But it's fair to say that you are experiencing some hearing loss, or? Okay,
Mm-hmm.
all right. And does that fluctuate, or is that just kind of constant in one ear or both ears?
It fluctuates. When I'm having a Meniere's attack, it's very hard for me to hear, besides the fact that I'm already disoriented. But, and then if I'm having like tinnitus, then it's definitely difficult to hear. But after my Meniere's attack, my hearing feels more normal.
Okay. And how long do those attacks generally last?
They can last for up to 8 to 12 hours.
Okay. Any drop attacks?
Yes, I do have drop attacks.
Okay. All right. Any headaches associated with what's been going on?
Yes, I get migraines that are pretty bad but not debilitating.
Okay. Taking any medication for the migraines?
I don't receive medication for the migraines, but for all of my symptoms, they prescribed me Finagrin.
What about sensitivity to sunlight with the eyes?
I have purchased special sunglasses that are rose tinted, and they help block out certain sun rays, because when I have like flashing lights or if I'm in the sunlight, then it can trigger a Meniere's attack.
What about driving at night? Oncoming headlights?
Mm-hmm. I drive at night as little as possible.
Okay.
I am very unflexible, and especially in my neck. I feel that I'm more restricted tilting to my right.
Okay. Does any of that carry over into the shoulders?
I do experience quite a bit of shoulder pain. I actually go to a chiropractor, and she's been helping me try to loosen up all of my muscles in my back.
Okay, how long have you been seeing the chiropractor?
I've been seeing the chiropractor for about 2 to 3 months now.
Okay. Any help?
Yes.
Wonderful. Wonderful. Okay.
I have very poor sleep. It is hard for me to get comfortable and find a position that's comfortable, but mostly I wake up constantly during the night, and especially recently my sleep has been really terrible. So sometimes, especially if I'm swallowing medicine, it feels like food or pills will get stuck, and I have to drink even more water, and it still feels like my throat will close up.
Okay. How long has that been going on for?
That's been going on since I was a kid.
Okay.
I especially noticed it once I was about 17.
Okay. So it's something that's still affecting you now.
Mm-hmm.
How many providers have you seen in seeking an answer for what's going on?
Besides, I've been to many like primary care physicians trying to find one that will be of most help to me, but I've also been to GI doctors because I thought originally it was a gastro problem. I've been to like heart doctors because I thought it was a heart problem, and then once I got an ENT, and he immediately diagnosed me with Meniere's, like in that first session that I met him.
When did you get the Meniere's diagnosis? How long have you had that?
I've had the Meniere's diagnosis since I was 20, so in mid to late 2019.
Okay. So 2.5 years?
Mm-hmm.
Fair enough. Okay. We're going to check your bite for interferences, timing, and balance. And if there are concerns with those, correcting them can alleviate quite a bit of your symptoms. Of course, we don't know that until we actually do that, but I'm confident that your interferences are such it's engaging the neurology, and the neurology has far-reaching effects from the teeth into the rest of the body, which is something that dentistry ignores, and is ignorantly blissful, continuing to ignore, unfortunately. So Danielle, you just finished round 1 of the therapy. Is it what you thought it was going to be?
It's what you told me it was going to be, but it was like shockingly easy.
Yeah. Any sensitivity to the adjustments?
No, my mouth feels fine. I am feeling like dizzy and a little bit vertigo-y.
Sure. That's not uncommon with patients whose symptoms present as Meniere's disease. Is it fair to say that your teeth hit all at one time when you come together?
Mm-hmm.
Mm-hmm. Does it feel even all the way across? Do you feel like you can have a greater range of motion to the right and to the left when you actually shift?
Yeah, I feel like my mouth just had a spa day, and so now it's all loose and...
Oh, immediate relaxation of the muscles. Okay. What about when you tilt your head to the right?
No, I feel like significant improvement of range. Like I can like see my back.
Okay.
Yeah.
Pretty interesting.
I do know that it feels less like stiff, and like I was telling my doctor I feel like there's lactic acid buildup in my muscles around here, and so now it kind of feels like there isn't that like tense feeling.
Yeah. Yeah. So this goes along with that whole premise that there's neurologically involved structures, or there's a neurology involved with the teeth that a lot of us are ignorant of. And so you're feeling those results. Nowhere in dental school did I ever, or my residency, did I ever hear a doctor in the books say, oh, well, if you get the bite right, muscles can loosen up in the neck and the shoulder and, the face. Never taught that. So to find a doctor that gets it, they have to really be passionate about what they're doing and pay attention to what patients are saying, right? Mm-hmm. Because had I not asked about the neck, would you have even, tried that after leaving here? Probably not. I guess it remains to see how long it takes you to improve, or from this point, all the other symptoms that we didn't talk about, because you listed like 25 on your sheet. So how often are the Meniere's attacks coming?
They're coming about once a month.
Okay, so it's going to be 4, 5, 6 months before we can look back on today's therapy and say, well, have you had any of those, right? Mm-hmm. So just kind of know that, and it's quite possible that your symptoms can fluctuate a little bit while the body is figuring out this new position. Mm-hmm. Okay. Any questions for me about anything?
Not a question, but I do notice that my tongue isn't like moving around a lot in my mouth. It feels comfortable, if that makes any sense. Mm-hmm. Like I feel like there's never like a comfortable place for my tongue to sit, but now it's just like it feels relaxed and it feels like it's in place. So that's just something I immediately notice.
Welcome back. This is our third visit. So tell me what you've noticed since last visit, or since this whole thing has gone on.
I've noticed that a big part of my Meniere's was visual stimulation would trigger my Meniere's, and it would, vertigo and all that. So things that, or if it was very bright outside, that would be very triggering for me. And so this time of year is always very sketchy for me. But the other day at work, I had to be outside all day, and it was super bright, and I didn't get tired or start feeling kind of nauseous until the very end of the day when I was on like my 8th hour outside. So that felt really nice. Like typically by like hour 2 or 3, I would be exhausted and wanting to go home.
Sure.
And then I also drove to the coast a while ago, and actually I drove to the coast twice. And it was really nice because driving it can be very hard for me because like it's just a lot of visual information and then the motion sickness in a car. But I noticed that I was able to comfortably drive there and back, and I wasn't tired, and I didn't get nauseous or have any motion sickness during the trips.
And that's actually a big thing, because those that don't know what the roads are like between Eugene and the coast, some section of those are straightaways, and other sections of that road is very windy. Even for somebody who doesn't even suffer from vertigo. Like, I hate that stretch of highway. It's a lot of blind corners. All right, so vertigo is vastly improved?
Yeah, I do still have very minor vertigo, but I notice that it's triggered if I have like multiple bouts of things all at once. So say I had a really long day at work and I had poor sleep and and if it was like a multiple list of things, then I'll have like a little bit, but not nearly as bad as it was. But yeah, otherwise things have been improving really well.
Okay.
So I've had very minimal ear ringing, like almost none. I can't remember the last time that my ears rang like to like a distracting point or anything.
Okay.
Yeah.
Well, that's good.
And my sleep has been much better. Like,
how about that?
Which is crazy to me. I didn't realize how poorly I was sleeping until like I got some good sleep and I wake up feeling well rested.
Yeah.
Like that's like almost foreign to me. No other questions. I think that I do notice that with my body and like my head very specifically, my like you said earlier, the muscles like over time they come together differently, and so my body feels different, and I do feel like I have to like relearn a little bit of how to navigate in my body. Like typically, I think I've mentioned multiple times, stairs are really hard for me, but recently I've noticed that like I've been able to balance myself differently so I can go up and down stairs easier, and so that's just something interesting I've noticed.
Danielle, you're back for another DTR post-op, and this is what, our 5th, 6th one?
6 sounds about right.
Okay, so I've been seeing you once a month since about January, February-ish. I know we had some COVID things where we had to reschedule, and that's just life in 2021. But I wanted to just kind of get a feel for where you're at and what you've noticed that has been improved since starting this.
Yeah, so the biggest thing that I've noticed is that my balance has improved significantly to the point that for college I felt comfortable purchasing a lofted bed, and I feel comfortable getting up into the bed and getting down from the bed.
That's big.
Yeah, it saves so much space.
Yes.
Another thing is I'm less tired when I sleep. I sleep through most of the whole night. And when I wake up in the morning, I feel like refreshed and I feel ready to go and conquer the day.
Okay, good.
Yeah, I still have like ringing in my ears, and I still get kind of mild headaches from, like stiffness in the back of my neck, but they're not nearly as bad as like what they used to be. They're not like migraine level or anything. It's just like, oh, it's just a mild headache. I think if I like iced it or something, then it would like feel better.
Sure.
Yeah.
So, fair to say that symptoms are down, duration, intensity, and frequency are all improved?
Mm-hmm.
Do you know how many symptoms you came in with?
Like in the beginning?
Yeah.
Oh god, a lot. I remember I think I circled almost everything on that paper you gave me.
Yeah. So it's great because we should kind of show you this when we get towards the end. This is you when you came in, right?
Mm-hmm.
This is you today.
Yeah, I had 24 and there were things on the list that it was like, oh no, I even have more than this. But then now it's just like, yeah, that's amazing.
So, you glad you did it?
Oh yeah.
Okay.